Spinal Truth Show, weekly podcast edition. I'm your host, Dr. Caleb Slater, here with Chris. Chris has sciatic nerves. 1, 2, 3?
To be determined.
To be determined. Before we start, make sure to like and follow us on TikTok, Instagram, Facebook, YouTube, Spotify, all the main ones. We appreciate the follows, and if you want to reach out to us for questions, that's a great, especially TikTok and Instagram, as well as YouTube are some good places to do it. This week's episode is about sciatica.
Yeah, everybody knows about sciatica, right?
Yes.
At some point in their life.
Everybody knows about sciatica at some point in their life. Back pain, sciatica. I now treat sciatica completely different than I did when I throughout the majority of my career.
Really?
Really.
You don't just throw a hot pack on that bad boy and walk away?
I no longer do hot packs.
Okay.
So I actually got away from all of the palliative treatment. Palliative means temporary, right? Like makes you feel good, but doesn't typically necessarily have a long-term effect. And you'd be surprised on how much of that treatment is our typical medical treatment. So hot pack and stim, palliative, just makes you feel good in the moment. And again, you can argue blood flow and healing and stuff like that, but in general, it's a temporary effect of feeling better. Then you have cupping, you have massage, you have taping, you have Graston, you have trigger point, you have dry needling, you have acupuncture. Let's see, what else? You have ultrasound, you have laser, all of this stuff. And by the way, I've done every single thing that I've mentioned, I've done to myself or my patients in my career. And I don't do it anymore.
How many of those things that you do once and then they're fixed? Like, is that ever a thing where someone
would... things you do once? If it is, I think it's one of those like fluke,
right.
You know, it didn't necessarily fix them, but they were just going to get better regardless.
Regardless, exactly.
And so I would say none.
Yeah, that's what I thought. So what is sciatica pain?
Sciatica is an irritation of the sciatic nerve. The sciatic nerve, it gets formed by a bunch of nerves that come out of your lower back. So your L4, L5, S1, 2, and 3 nerves. They form your sciatic nerve. Your sciatic nerve goes down your leg to innervate, to supply, let's call it, we want to say energy, supply information, supply what? An electrical signal?
A signal. Yeah.
All right, to give a signal to your leg, to your muscles, to your bones, to your fascia, to your tendons.
It's essentially how your brain communicates to your body.
How your brain, yeah. Well, that's a great, it's how your brain communicates to your body.
Yeah. But specifically down the leg.
Down,
hip down.
In general, your body works down and out.
Yeah.
So it goes brain, brainstem, spinal cord, spinal nerves, down and out. In general, something above can affect lower, but something lower doesn't necessarily affect above. I know a lot of people would argue with that, and I've done the whole like, if it's your back, it's your foot. If it's your back, it's your hip. If it's your back, it's your knee. And now I'm like, if it's your back, it's your back.
It's your back, yeah. But why is it so common that most people have dealt with sciatic pain at some point in their life?
It's a good question. I have a lot of answers to that. One of them is the treatments suck.
Okay.
In general, we are now specifically a very sedentary society, right?
Yeah.
Most people, let's say 50 years ago, they would get injuries from being active. We now get injuries from being inactive. So it's changed. Your back obviously takes up a lot of the force. But yeah, it probably shouldn't be that way.
Well, I think for me in my life, and I think for a lot of people, when you have sciatic pain, what you normally do is nothing and ignore it, or you take some Tylenol and you continue on with your day.
Right, and until it gets bad enough or for long enough until you go to the doctor. And by that point, it's a different animal. It's more, it's chronic, it's maybe multi-level. You've been treating it wrong for a long time.
50 years though, so we're talking like the 80s.
No, 70s. Let's not.
Oh yeah, anyways.
Yeah.
Yeah, 70s. Okay, yeah, that would be different. Jobs are different. There's not a lot of, I think the majority of people are, at a desk or a computer or something like that nowadays. Right. So just sitting hunched over, is that something that will?
Yeah, and a lot of people, so again, I now view this problem differently than I viewed it for a long time. And for the record, I'm a physical therapist with 17 years experience. I am an expert orthopedic physical therapist. So I have 4 advanced orthopedic certifications beyond my doctorate. I started and grew my own practice with my wife, who's an expert physical therapist. I wrote and published a book. Like, I am, by all intents and purposes, I'm an authority on this. And for a long time, I treated this just like everybody else out there treats this, and that would be your core stability exercises, your core neutral strengthening. That's your planks, your dying bugs, your bird dogs, your side planks, your pal-off presses, your breathing, diaphragmatic breathing. A lot of clamshells. Love a good clamshell for treating your hips, to treat your back.
What's a clamshell look like? Just what I think it does?
Yeah, put your feet together, bend your knees, and then spread your knees apart while keeping your feet together. So it looks like a clam opening.
Gotcha.
It's to work your hip external rotators that could put pressure on the sciatic nerve or could also help support your low back. I've done strengthening your lats, which go into your thoracolumbar fascia to help support your back. Strengthening your erector spinae, so the erector muscles on your back, or your multifidus. I've done all of the stuff that you're going to get if you go to a physical therapist. And I found that it generally just doesn't work, or at least it doesn't work well enough.
Yeah. I mean, I know what you're going to say to do. We'll get there. We'll reveal that at some point in this podcast. But I do recall what you're saying, at least like in like maybe 10 years ago, it was like the norm that I would hear all the time is, you know, the most important thing you can do is like a plank, because you got to get that core strength.
Right, core strength.
Yeah.
Yeah, in neutral.
In neutral.
Neutral. Don't move your spine. Movement is so I love that everybody says like motion is lotion and like movement is key, and then as soon as it's a back problem, it's like, don't move it.
Yeah.
Don't you dare fucking move your back, because if you do, you're wrong.
You are fucked.
But motion is lotion and movement is key, and yeah.
Okay, so sciatica has long been a common thing you've treated, I assume?
Yeah, again, back pain, sciatica is the #1 symptom that we have orthopedically.
And if you identify they're having an issue with their sciatic nerve and you prescribe them some exercises or whatever, how long until they see results usually?
So you have to qualify so you have to change. I expect to see change on the first visit.
Yeah.
I expect to see some decreased pain, some improved mobility, some improved strength, some decreased stiffness on the first visit. You have to qualify what changes. So in general, I expect 50% improvement or more within about 4 to 5 weeks.
I'm guessing the qualifier is that sciatic can cause multiple things. Foot, knee.
And it can be bilateral, so it could be on both sides. It could be one-sided. It can start bilateral and go to one side. There's a bunch of reasons that you could get an irritation of your sciatic nerve, which is sciatica. Okay, it could be a herniated disc, it could be degenerative disc disease, it could be facet arthrosis, it could be spinal stenosis, that could be central or unilateral or lateral. So there's a whole bunch of reasons that you could get this nerve irritated. So the treatment does need to vary a little bit, but for the most part, most people respond to just moving their spine through its full range gradually and being told how to do it, and then strengthening their spine, not in neutral, but through its full range, either into flexion, bending forward, or into extension, bending backwards. And I have found more often than not, most people actually need to bend forward and strengthen in that range, which is the complete opposite of what you would be told to do, because if it's not core neutral strengthening in today's like current medical system, then you need to extend. And so extension is a big McKenzie component. I talk a lot about McKenzie physical therapy, which is like a subgroup, educational group of physical therapy that you can get trained and certified in, which I am. And one of their biggest things is a press up. A press up is kind of like a cobra stretch, where you're just pressing yourself up and you're arching your back. And they use this to treat low back pain, sciatica. I use this for years. I have one patient, specifically after like doing my courses and my certification, that I had him do press ups in a corner for like 45 minutes. Like he'd do a press up and then he'd rest in an extended position and then do a press up and blah, blah, blah. And like now looking back on it, it's like funny / embarrassing.
Yeah, it's like, but aren't I kind of extending forward?
So that's a really good question, right? when people say sitting, they tend to say that your lower back is flexed.
Yeah.
I actually think, for the most part, your lower back is still neutral, if not even a little extended, right? Is your low back pushing against the chair? Your low back?
No, there's space between
There's
my
a
low
space,
back and
right?
my,
You know
yeah.
why there's a space? Because your low back is so rigid that it's actually not flexing when you're sitting.
So I should be, if I was seated with my low back against the back of the chair.
Well, but now you just changed your position, but that doesn't mean that your low back is actually flexed.
Right.
So think about this again, kind of like the computer age, and we'll say typewriter, computer, which puts us back right around like the 70s, where you know everything's more computer oriented, right? 70s, 80s. We started really flexing forward at our thoracic spine, right? So, all right. This might not work for people at home, but just try to picture this. I'm going to lean forward into this mic, okay? Now I'm basically the way that we sit. I'm hunched forward, right?
Yep.
And now I kind of get stuck here with my thoracic spine, okay? But now you're going to come over to talk to me.
Yeah.
What do I need to do?
Look up.
I need to look up. How am I going to look up?
With your neck?
Well, remember, I'm kind of stuck here. I've been doing this. I'm basically a
Are you
turtle.
gonna sit back?
I'm a turtle at this point, right? My upper back is hunched. My neck is stuck here. How am I going to look up?
I don't know.
I'm going to arch my back, my
Okay.
low back, right?
Okay.
So I actually think a lot of us now arch our low back when we sit. We arch our low back to like look up,
Yeah.
right? Because our thoracic spine doesn't move that well. I think a lot of us are stuck in extension. And I was trying to think of the why. Like why are a lot of us stuck in extension? And that to me makes sense. Is that we're stuck in flexion in our upper back, our thoracic spine. We're leaning forward, our neck is forward, protruded forward. Our upper back is rounded and stiff, and we really can't get out of that position. It's a stiff, stuck area because of the ribs, because of the scapula, your shoulder blades. Like that area doesn't move well already. So, and now you've been like this for decades.
Yeah.
How are you going to compensate? You're going to compensate with your lower back.
So your lower back's compensating.
Your lower back,
Yep.
yeah. In order for you to stand upright, to look up, you actually have to arch your low back.
And that makes 100% sense.
Thank you for watching the Spinal Truth Show. I hope you're finding this information helpful. If you're out there and you're still in pain and you're looking for relief, we have some solutions for you. You can schedule a consult with me or a session, but if that's not in the budget, we also have some options that are self-guided at home. You can go to thespinaltruth.com. We have courses set up right now for arm pain as well as for neck pain. They are geared towards you. They are a 4-week course, 60 videos that are self-guided by an expert in the field that you can do from the comfort of your own home at your leisure. They will take you through step by step the typical approach that I take with patients. The expectation is that they will provide significant relief over these 4 weeks. So if you're looking for something better, something different because you're not finding the relief, go to thespinaltruth.com, sign up for one of these courses, and get the right treatment, see the difference.
What if you are active? What if you're like a runner or something like that, but you have like knee pain? Could that be?
That could absolutely be your back, right? Your sciatic nerve does innervate your knee more on the outside of your knee to your shin. The femoral nerve, which is, they kind of share a nerve root, but more innervates your thigh and the inside part of your knee.
Okay.
That being said, so now you would say like, well, what if you're active, right? Well, most activities are lumbar extension. You just said walking. Walking is lumbar extension. You need to extend your lumbar spine in order to walk. Running is more lumbar extension. Sprinting is even more lumbar extension. And now you go to activities. What do your daughters do?
Dance.
Lumbar extension.
Yeah.
Volleyball, lumbar extension. Football, like if you're a lineman, lumbar extension. Cheerleading, lumbar extension. Gymnastics, lumbar extension. Like it's a lot of the activities that we do are actually lumbar extension.
Okay. So I know what the exercise is that you're going to do, which is the Jefferson curl.
I do a modified Jefferson curl.
Yeah.
I do it a little bit differently than you would find it online.
And that's something that is easy to do.
It's easy to do.
You do it multiple times a day, or?
Yeah, and when I work with patients for the first 3 to 4 weeks, I have them do it 2 to 3 times a day.
Okay.
And then with the goal of right around like 4-ish week mark, depending on their symptoms and stuff like that, backing off to once or twice a day.
Okay. And then will that start to alleviate, like say if they have, is that something you would apply if they had like foot problems?
Yeah, well, so a lot of people with sciatica will end up getting diagnosed with like plantar fasciitis because they have pain into their feet, specifically the bottom of their feet, and the doctor is gonna, again, they're gonna go in, they say I have foot pain, the doctor is gonna ask them about their foot, look at their foot, eventually plantar fasciitis.
Have you ever had like a quick stabbing pain in a toe or something like that?
Yeah.
But like doesn't last.
Right.
Is that?
Could absolutely be a nerve.
Because I've had that before,
Yeah.
and that's what I assumed it was something to do with my sciatic nerve.
Oh, yeah, and it probably was. You probably had a little bit of a pressure on it or a little bit of a stretch, and it just pissed it off.
I think I've had it laying in bed.
Yeah. Well, and all right, so again, and that is going to be, but laying on your back, your lumbar spine is an extension. Laying on your stomach, your lumbar spine is even more an extension. Laying on your side, unless your knees are like pretty much up close to your chin, your low back is actually in extension.
What if I laid on a foam roller?
If you like, it was vertical along your spine?
Yeah.
You're laying on your back, your low back's an extension.
Okay. I didn't know if there was something I could do to compensate.
Again, unless your knees are up close to your chin, your low back is pretty much in extension.
All right, so if I'm doing the happy baby in bed all day.
Happy baby, you are in flexion. Look at that.
And that's what I need to be doing when I'm watching TV.
Well, and so now you start to think about this, right? Like your upper back is flexed. What is that? How do you compensate for that? Lower back extension. When you're active, walking, running, sprinting, dancing, cheerleading, your lower back's an extension. When you're pregnant, especially for the last 6 months of your pregnancy, your lower back is in increased levels of extension and decreasing flexion. You literally can't bend forward. If you're a guy, guys, we carry our weight in the front of the abdomen, right?
So I've heard.
Yeah, right. You have a mechanical obstruction.
Wouldn't know about that.
You have a hard time going forward.
Yeah.
All right, so now that kind of makes sense on why everybody's back is stuck in extension these days, right? But what does that do to the back? Because what a lot of people do for low back pain is actually moving them into extension. The reason they do that is because theoretically, if the disc herniates, the disc tends to herniate posterior lateral. And a herniated disc, think about it like a balloon filled with sand. Like you squeeze on one side of the balloon, the sand moves to the other side, distends the balloon, but stays in the balloon. That's what our herniated disc is. It's not a bunch of like goo seeping out all over the place, right? This herniated disc now gets in the way of the joint. So now when you bend to the side, you can't close down on that joint. This herniated disc also could put pressure on the sciatic nerve, the nerve root, and now it irritates the nerve. And wherever the nerve goes, that's where you feel your pain.
Yeah.
So theoretically, if the balloon is bulged back there, if you slowly squeeze down on it, you can actually move the material back to the center. So that's what they're trying to do. But if your back's already stuck in extension, number one, when your back is in extension, you actually close down the frame in these little holes on the side of your spine where the nerves come out of, where the nerves, your spinal cord goes to spinal nerves, so it sends little branches out, and it goes through these little holes on your spine and on the sides. When you are in extension, those holes are naturally smaller. Okay, so you're already closing down on that in extension. They're trying to argue that if you move the disc, if you're moving the disc out of the way, extension is good. But if you can kind of picture that disc bulging out, if I'm closing down not on the end of the disc, but more in the middle of the disc, I could actually make that bulge worse.
Worse, yeah.
Right? So now you're starting to think of well, why isn't this working? And again, I spent years doing this approach. Before I did McKenzie physical therapy, I did your typical core neutral strengthening. This is your McGill 3. This is planks, side planks, bird dogs, bridging, stuff like that. Core neutral strengthening. And then you're starting to think, why doesn't that work? Well, your body needs movement. Your body needs movement and also needs strength. And a lot of these motions aren't really resisted. They're very light resisted if they are, right? They're just using your body weight, gentle breathing, gentle movements, not enough to cause that change in tissue, not enough to cause strength, and definitely strength changes, and definitely not enough to, and you're not moving enough. So you're stuck, right?
Yeah.
So then I started thinking all right, well, if people are stuck in extension and people need movement and they need strength, why not just move them in the other direction? So I started doing the Jefferson curl, and you need to know what to expect and what to feel and how to do it. Like you need all that information, right? You shouldn't just go right into this and like power through.
No.
Okay, it should be gradual, progressive loading, progressively increasing the weight with it, progressively increasing the range, progressively increasing the intensity of the abdominal contraction that I have you do during it. You should know what to expect. Back soreness, less symptoms in your feet. You should, we can explain the centralization if you want here. But you need that information because you need to know what means good, keep going, and what means bad, stop. But doing this, I've had so much more success with so many patients who have failed the typical approach.
Yeah.
And you can hear from some of them, we have some episodes where we interview them on this show, right? If you look back, there's got to be, I know there are some episodes, I don't know which ones they are, but where we interview patients that were told that they needed a fusion or that there was no other treatments for them other than pain medication. And we did this approach with them and they got better.
So is a fusion something that's common with people with sciatic?
Yeah, with back pain, right?
Yeah.
I mean, so you're going to have back pain, that you're going to try to get it treated. The treatment is typically like physical therapy or chiropractic, and then maybe some type of like anti-inflammatory. They might give you, oral steroids or pain medication, which all that is numbing you to your symptoms, right? Once that fails or your symptoms are high enough or they've been going on long enough, now you go more into, I don't want to call it treatment because it's not, it's pain management. So now you start doing injections. You do an epidural injection, or you do like a local facet injection. Again, just numbing you to your symptoms. Once that wears off or it doesn't work, now you're starting to get into the more invasive stuff. They might try that now it's going to be a surgery. They might try a discectomy, laminectomy. They might try nerve ablations where they chemically or thermally burn your nerves so that way you can't feel your symptoms, which that just sounds like such a dumb process, right? Yeah. And I get it if you're in pain and you don't want to be in pain. It's horrible, but it just sounds, honestly,
it doesn't sound like
stupid.
It's fixing the problem. It's just
obscure. Yeah, it's right.
You still have it, you just don't know it. Yeah.
And then once all that fails, now you're pretty much left with a fusion.
Gotcha.
Once you get a fusion, within the next 5 years, it's very likely that you'll have another fusion for the level above or below.
Because it keeps compensating.
Because it keeps doing it. And now, by the way, the reason you sought another fusion is because you're still having symptoms. And during that time, they're giving you the same epidurals, steroid injections, oral medication. Now you start moving up to some of the higher level medication, your Dilaudid, your fentanyl, stuff like that. Like you're going up in aggressiveness.
Yeah, until that's just your new normal.
And now the final thing is going to be a dorsal column stimulator. So they're going to put this stimulator implanted in your spine, which what it does is it interferes with your brain's perception of your pain. So it's the same thing as the nerve ablation. It's just an electrical impulse that does this. You're going to get it. It's going to work at first. You're going to turn it up because it stops working a little bit, and then you're going to max it out. And then your pain's going to come back, and it's not going to work. They're going to turn it off, and they're going to leave it in your body. There you go.
There you go.
And there's your journey of back pain. Hey, just a quick break here, and then we'll get back to the show. If you're out there and you want to see if this is the right approach for you, you can schedule a consult or a session with me. Go to thespinaltruth.com. At least set up a consult. Within 30 minutes, I will listen to your symptoms. I will go over your history. I'll go over what the approach I would take for you and the results that I would expect. My goal is to save you from continued pain, failed treatments, and prevent you from getting surgery. So go to thespinaltruth.com, set up a consult, and let me go over your symptoms. Now let's get back to the show.
Well, let's talk about, I guess from my more personal experience, I assume I have some sciatic stuff. I should probably do the Jefferson curl. But for me, my back pain is minor. I get obviously from sitting a lot. But what I noticed, like I did a bunch of lunges 2 days ago. And during the lunges, and I was feeling it in my hip and knees.
When your hip extends, so does your back.
Okay.
So it's an extension moment of your back.
So that makes sense.
Right.
Like I was saying, I had a little toe thing occasionally here and there. Also, if I go for a run or a jog, not like a full-out sprint, but like a jog, my knee will hurt. Mm-hmm. These to me all seem like, all right, it's all sciatica.
Yeah, very well could be. Again, with your knee a little higher up, but the problem so your knee, primarily innervated by L3, L4. So a little higher up than your sciatica, but again, the problem is that area also stuck in extension, and the treatment move it into flexion. Yeah. So it'd be the same. So it's I don't want to get blown up on this channel for saying your sciatic nerve innervates your knee, which it does, but it doesn't. But the treatment
would be the same.
Would be the same.
So, but I think there's a lot of people out there that are in scenarios like me, because like we were talking about like worst case scenarios where it's like so debilitating. But there's a lot of people who probably just have these minor back and pains, or
Yeah, and the cool thing is people in your position, if you give them the treatment, they respond so quick. You asked me how long, like 2 weeks, and you're feeling amazing.
Yeah.
Yeah. Like you're a little sore at first, but in your back's sore because we're moving some stiff stuck areas, your muscles, your tendons, your fascia, your joint capsule, your ligaments, they're all shortened and stiff, so we're stretching them and moving them. So a little bit of soreness, but within 2 weeks you're like, man, I feel significantly better. You're not stiff getting up out of a chair anymore. Your legs feel better, lighter. Like there was some pressure taken off of them, because there was pressure on the nerves, and that makes your legs feel heavy. More energy through your legs too. Another sign of like nerve issues, and a lot of people don't know this, is fatigability. So like you're like, man, my legs are just like, it's not like a cramp, but they're just getting heavier and fatigued, tired, and I need more rest for longer until they bounce back. That's an early sign of a nerve issue.
Interesting. Is DOMS similar to that?
Delayed onset muscle soreness is from working out too much too quickly. Yeah.
Okay. All right. So is there any other kind of hidden things or things that you might not think would be part of sciatica?
All right. A lot of people also have like hip pain. Hip pain really isn't sciatica. Right?
All right, so I think I have hip pain.
It's too high. Yeah. Okay. So you'll all right. So here's something that I see a lot.
Okay.
You'll get a lot of people that they have what seems like sciatica, right? And they go to the doctor and they're saying like, look, it's all down my leg. It's the front of my hip to my knee to my foot. And they're like, sciatica? No, the front of your hip is higher up, L1, L2. It's not. It's your lumbar spine, and the treatment's the same, but it's not sciatica, right? A lot of times treatment involves stretching. Nerves don't like to be stretched, okay? And for the people out there that have tried this, like you have quote unquote sciatica, so they'll give you hamstring stretching, they'll give you nerve gliding or nerve flossing, it's the same thing, just different terms. And it kind of like feels, it hurts a little bit, and then you kind of like have a little bit of like a numb sensation to it, and then later on your symptoms are worse.
Okay.
Nerves don't like to be stretched.
Gotcha.
Especially an irritated nerve, when you stretch it, it just irritates it more.
Is there anything that the sciatica wouldn't respond to your Jefferson curl or something like that? Like, is there
so there's definitely like maybe an anterior listhesis, like slipping forward of one vertebrae on the other, an unstable spine, maybe a large posterior herniation. You can make an argument for some acute low back pain, although I would just temper the range and the force with it. In general, your body needs to move. You should have full range of motion, and you should have strength and control in that range. And that's really what I progress with my patients. So for the most part, no, your low back pain should improve with restoring normal motion and restoring strength in that range. Are there exceptions? Yes, there always are. A compression fracture would be another one that you'd want to look out for. Or if somebody had a history of like something like that.
Okay. And I think I know the answer to this, but is there a specific activity or thing that you see common with people who get diagnosed with sciatica? I assume almost everyone, because of sitting.
No, so everybody, but but it's a weird combination of sedentary and then active. Like you know how kids used to just go out and play?
Sure.
Well, now does your kid ever go out and play unless they're going to an organized activity?
Nope.
And if they're not in that organized activity, what are they doing?
Sitting.
Okay, so and this is the case for probably a lot of people, and especially a lot of children these days, right? You are either very, very inactive or very, very active.
Yeah.
So you're going from you're like, man, I haven't done anything, I'm stiff, I've been in this position, I'm weak, I'm like deconditioned to high level activities. More so like my wife was just telling me the other day that she was at a birthday party and the one woman showed up late with her kid because her kid was in D1 soccer and her kid was 8 years old.
Yeah.
And we didn't know there was D1 soccer for 8 years old, right? Like, and that kid, same thing. They probably go from sprinting and drills at soccer to at home on their iPad.
Yeah.
Right, sitting. So we really lost a lot of the in between, a lot of the, hey, I'm just out riding my bike, playing with my friends, hanging outside of a convenience shop, making trouble, right?
Yeah, just like casual movement.
Right, casual movement. We don't really do that anymore. We either are sedentary or we're doing CrossFit.
Yeah. Yeah, that's true. So okay, so say I have a 9 to 5 office job. What should my
once in a while throughout the day, get up and bend forward, and then
like touch your toes kind of deal.
Yeah, but that's kind of more of a stretch.
Okay.
So it's more this modified Jefferson, and the difference is that one, you're trying to rely on the mobility coming from your spine. The other one, you're just like pulling at your muscles and tendons and nerves, right? You're not restoring mobility. You're keeping your spine stuck and rigid, and you're just pulling on it.
Can you do a Jefferson curl without a weight?
You absolutely can. I teach my patients that, because throughout the day, I want them to offload their spine. I want them to offload their nerves. I want them to move out of the position that they've been stuck in. And one thing that I teach them, like with my modified Jefferson curl, like the difference is, number one is I really try to get them to roll from the top down, not just lean forward. And I try to get them to do the movement by using their abs to control the motion. This provides stability, it provides control, and then you also get something called reciprocal inhibition, meaning if I contract one side of my body, I send a signal automatically to the other side telling it to relax. So if I'm contracting my abs, I get a signal to my back musculature telling it to relax. Gotcha. So you get you actually get a better stretch that way. I have them keep their knees a little bit bent to take pressure off the sciatic nerve. And then the final thing that I have them do is once they get all the way down, I have them then go into a deep squat. And this helps with general spinal mobility, and then it also gets you like kind of a lower back stretch in that deep position. And it gets you in a position that you should be in more throughout your day naturally, just like, kind of a deep squat.
What if you're unable to get to the deep squat?
I make modifications, but for most people, just holding on to something, and that's actually where the weight, it acts like a counterweight. So you hold it out in front of you, and now all of a sudden you can deep squat. Maybe you put your heels up on something if your ankles are limited in mobility, or maybe you hold on to something in front of you like a chair in order to do it, or maybe you just go down as far as you can, come back up, and when you do it again, you try to get a little bit further. Like part of it is restoring motion in that range. And you know what? You'd be surprised on how many kids can't deep squat.
Yeah.
If you're out there, go home, ask your kid to just put their feet about shoulder width apart, facing forward, and have them squat as far down as they can. They should be able to go all the way down where their hamstring is touching their calf, and they're as deep as they can go. But I can guarantee you about half of them are going to fall backwards.
Yeah, I think so too. So sciatica doesn't sound like that big of a deal.
It's painful. It's painful. It's painful in your legs. It's painful at rest. It's painful with activity. It can cause numbness and tingling and weakness.
So that's actually a good point. All right, so maybe this is also related. I walk a lot, and there are many times where, like, it feels like my leg fails for a moment.
Yeah, that's nerve irritation. That's your fatigability, right? And so a lot of people don't know this, but pain is actually your initial response. Physiologically speaking, pain is better than tingling, numbness, or weakness. Mm-hmm. I would much rather my leg be numb or weak than in pain, but again, physiologically speaking, pain is better. Pain is your initial response. I put pressure on an area, it hurts, I pull away. I put pressure on an area, it hurts, I can't pull away. Eventually I put enough force over long enough time to damage that nerve. A damaged nerve goes from pain to tingling to numb to weak. And it doesn't always follow that so linear, but if you're at the point where your leg is always numb, it's never not numb, or you're at the point where now you're starting to get to the point where you definitely need to do something about it, and that something might need to be surgery, okay? If you're at the point where you are weak, like you're getting foot drop and stuff like that, now even more so, you definitely need to do something about that, and that something might be surgery.
Gotcha. Well, I think it might be like if you're getting older in age too, where you're starting to have that kind of failure occasionally, like that can lead to falls.
Right.
And so
one of the biggest predictors of longevity is actually leg strength.
Gotcha.
For that reason. Your ability to get up and out of a chair keeps you active.
Yeah.
Your ability to have strength and control standing keeps you safe.
Yeah.
So leg strength
Makes
strongly
sense.
correlates with longevity.
Okay. So, I mean, is there a person out there who wouldn't benefit from doing a Jefferson curl regularly?
Again, we talked about it. There's some underlying diagnoses that you'd like an unstable low back, and a large anterior listhesis, severe osteoporosis, history of compression fractures.
But a normal person who works a 9-to-5 job at a desk.
Did you just call all those other people not normal? You are about to get lit up on social media right now. How dare you? And then how dare you call people normal?
For people, no one's normal anymore.
You're not allowed to, you can't be normal.
Everybody's beautiful in their own way, and I appreciate that. All right? But
for
if you work a typical job,
if you are
a typical
average person,
yes,
that you absolutely should be doing this. It keeps your back healthy. It keeps you healthy.
Regardless of if you're experiencing sciatica.
Correct.
Gotcha.
Ideally, you do it before you're experiencing sciatica, so you don't experience sciatica.
I mean, it's basically since working with you, I've learned that like doing the foam roller for my thoracic spine, doing the Jefferson curl for my lower back, like that will make me generally.
If you had to whittle it down,
that's
probably it, right?
Yeah.
Those two.
But I'm also someone who's not experiencing like anything major. I'm just minor back pain.
Yeah, minor daily life occurrences. Yeah, and I on a different podcast we were talking. I said this should be taught in school, and I think I think it should be exactly what you just said: the foam roller, and then the Jefferson curl. Are there other things to do? Yeah. Absolutely. But if you want to whittle it down to the two most effective, that gets the largest area of your spine, that keeps you healthy.
Well, I think those two things for me combat my sedentary lifestyle.
Right, and it's all we're looking to do, right? Yeah, and if you just do those two, that's pretty easy. I have a kid in Abu Dhabi who I was treating for Crohn's GI issues, and he was exactly what we were just talking about. He couldn't squat, like he couldn't even get to 90, let alone past that. And long story short, he's doing phenomenal. He's like 95% better. He's eating foods that he wasn't eating before, like pizza and ice cream without any recourse.
Yeah.
He was having difficulties playing like soccer because of fatigue. Now he's running, I asked him, how long does it take to do your routine? And he's about 8 weeks into this treatment. And he said 5 minutes. And I was like, okay.
5 minutes, life change.
5 minutes, life change, right? Yeah. And at the beginning, it was probably a little bit more. Like when you first start doing something, you're not as proficient at it, right?
Yeah.
But like now he's 8 weeks in. I haven't seen him in 4 or 5 weeks. I saw him recently. I said, I asked him that question just because I was kind of curious. 5 minutes. 5 minutes to keep your spine healthy in the morning.
You decide.
Right. Yeah. Or you can just yell at me on social media because you were told that you shouldn't bend forward and you should keep you should move everything because motion is lotion and motion is life, but don't move your spine.
Never move it.
Does it make sense to you?
It does not make sense.
It doesn't make sense to me. And I was trying to give some examples, and you get these pedantic, I'll call them assholes online, but like where I was saying like, look, if you have an elbow problem, right? And let's say my elbow, it hurts and it's stuck at 90 degrees. And I went to somebody and they said, okay, well, first thing to do, don't move it. Don't straighten it and don't bend it more. That's number one. Number two, I want you to do really, really light exercises in that range of resistance. Really, really light, okay? If somebody told you to do that, Would that make sense to you? No. So why does it make sense at your spine? Why does it make sense that motion is lotion and movement fixes, but not at your spine, the literal foundation of your body?
I mean, there does seem to be a fear in some people, and maybe a lot of people, where it's like, I'm thinking of someone in particular where I'm like, I know she would benefit from doing a certain exercise or something, but she's afraid she'll hurt herself, hurt her spine.
Well,
you know what I mean?
That's why you have to know what to look for. You have to go gradually, right? Like, so with this Jefferson curl, I got to the point where I was doing it with 120 pounds.
Yeah.
Okay. I didn't start at 120 pounds. I started at, I think, 20.
Yeah.
And by the way, when I started at 20, I was having knee pain. Okay. When I started at 20, my back hurt more than I thought it would have hurt. Like, I mean, like, it was sensitive to touch for a few days. Okay? So during that time, I did a little bit less. I didn't increase weight.
That was going to be my question.
I didn't increase the intensity of like my muscle contraction, right? I made sure that I didn't like do some extra stuff. Like I didn't lift real hard for that week or so, right? Because I was working through something. And I also know what to expect. I know what means my symptoms are getting better and what means my symptoms are getting worse. And it doesn't always look as linear or as obvious as you would think.
Yeah.
Again, if you had numbness and now if you had numbness in your foot and now the numbness is gone but your foot is killing you, it hurts, you're actually better.
Yeah.
But you need to know that. And a lot of times you need to be kind of counseled through it because it's one thing to hear. Every time I explain that to a patient, they're bobbing their head, yes, like, oh,
Totally
they're in agreement, completely understand. But then when you're in the moment and you feel it, you're like, something's wrong. Like, no, we talked about this. Like, it was numb.
You're getting better.
Now it's pain. This is just you taking the pressure off. This is your nerve waking back up. But it's going to hurt for a little bit.
Snow falling on a tree.
See, tilting it over, right?
Tilting it over.
Yeah.
Yeah. All right. Well, sciatica, it's a thing. Everybody has probably experienced it at some point. You have some more information now out there.
Yeah. And, you know, the final thing to say is, look, like if you're doing something, and I say this a lot, let's say you're doing your core neutral strengthening, you're doing the typical, you're stretching your hamstrings or flossing your nerve or whatever treatment that you're getting. Within 4 to 6 weeks, you should see significant improvement, somewhere around 50%. Your symptoms should be changing. If not, maybe consider that the treatment is wrong. It's the wrong approach, maybe the wrong approach for you. All right, well, that's our show. Thank you for listening. Hopefully we gave you some information you didn't have before, made you think about your body, your health in a little bit of a different way. If you have other questions, you can reach out to us at info@thespinaltruth.com. Also, you can reach out to us on TikTok and Instagram. Don't do Facebook. I should just stop doing Facebook. You can reach out to us on YouTube. Well, Facebook.
No one goes on Facebook.
No one goes on Facebook. And we can't get any followers on Facebook.
I don't understand Facebook.
Yeah. We're still posting to Facebook, right?
Every day. Multiple times a day.
And no followers. I haven't checked it in a long time.
It's like 350 people or something.
All right, that's, double from the last time I checked it, I think. But yeah,
it's ridiculous.
300, yeah. But we have 170,000 followers on TikTok and 300 followers on Facebook.
Yeah,
it's
almost like it's all throttled and it's a pay-to-play system.
Mark Zuckerberg.
He's not rich enough, guys.
All right, well, that's our show. Make sure to stay tuned next week for another show of some health-related content.
Look forward to that. All right.